I wasn't gonna leave it there, I was just gonna set it like right. Sound quality.
Do you need the sound more directed to the audience or to the commissioners? Up to you. Okay, well, we're going to go ahead and call it to order. We'll stand for the flag salute. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. Okay, we'll call it to order, meeting to order. Tina, you handed us some charts here just a minute ago. Or actually, you handed them.
Could we add animals to the agenda here?
I don't think so. It hasn't been publicized.
This is, you can add it.
I just assume not. I think we should have it scheduled on, you want to put it on Monday's meeting? That's just a couple days ago.
This is sort of a employee discussion or commission discussion on things that's coming up on the ambulance. Just nothing, no action needs to be taken.
So you're saying you want to go to executive session for it? Is that what you're asking?
It could be, but I'd rather just bring it out here in the public, and so the public hears it. It's all about the ambulance and things that's going to happen. So we haven't had no standing rule we couldn't add to the agenda, but.
Well, this is a work session, though.
Is this a meeting or a work session?
This
We
is
just-
a work session.
Well, it's a meeting.
It's a meeting.
It's a special meeting. It's not a work session because you may make a decision today on health insurance.
Okay,
And so
so
we did it as a special
A
meeting.
special meeting for the insurance. Am I right?
That's what's on the agenda, yes.
Yes. No, I'm going to say no. But I sure would like to, if you'd like to put on Monday's meeting, do we have room to put on Monday's meeting?
So, how long does it need to
No, 10 minutes at
10.
most.
We can squeeze it in there, can't we?
be? I think so.
Yeah. Well, I'd like some rules why we can't put it on here, and I don't hear no rules except for the chair seems to think we can't do things like that. So we'll let her have her way this time and continue on. But it's a shame when you don't want to work towards things for the better.
A lot of things that are shamed for not working for the better, so.
Oh yeah. And you're the cause of it, so let's move on.
Of course I am.
Yep.
Blame me. I mean,
Yep.
let's start the meeting out like we always do. Diane's at fault
That's what seems to be the problem.
because she won't go along with the good old boy system.
No, it's not a good old voice.
Exactly
That's
right.
the Marion County service.
Have you ever
So,
thought about you might be the problem? It's a very strong possibility you might be the problem too.
Seems like, Chairman, you have an outrage from the public here, so why don't you shut them up?
this is a public meeting and I will not shut them up. I'm even going to allow the people out here to speak. This is the
Well,
public. I'm going
that's the
now. And I
employees.
will tell you, I have the right to shut them up.
Yeah.
This meeting does not mean any commission meeting. I don't have to allow anybody in the public to speak.
Oh, okay.
Did you read the coma lately?
Yep.
I'm
Okay.
sorry, I just,
Then you know. You're fine, go ahead. I'm gonna let anybody speak. I have always been free to let anybody speak. Anybody. So, I was asking Tina about the schedules that she had given us, if she wanted to say anything about. Did you have anything to say about them, or did you have anything you want to point out about them?
Sure, Tina wants to talk about it.
Okay, well, maybe she'll come back to the meeting here pretty soon. So in the meantime, I assume that Kent,
If you're ready to actually have a meeting, I'm ready.
let's get to the subject at hand, yes. So I asked you about these schedules. Is there anything you'd like to point out about them?
Sure. Basically, get them all together.
That's fine.
So on the main sheet, what you have is basically you have 3 different companies. I pulled out similar options, all with 1,000, 2,000 deductible. So there are a lot more options and plans. I was trying to get it to where you could see as close to an apples-to-apples comparison between the plans as possible. So that's why I have pulled out these specific ones. The major differences, all of the plans are, somewhat similar. You'll see the deductibles and the coinsurance amount. I did highlight on the total out of pocket that pertains to coinsurance. The current plan that we have is the only one that has a total out of pocket they have a cap on the coinsurance, basically. So if you had, once you hit that cap for the plan year, that includes your deductible and coinsurance. Once you hit that cap for the year, the only other expenses that you potentially would pay out would just be for co-pays for doctor visits, and then there is a maximum out of pocket on that. So the Blue Choice plans are the only ones that actually have that cap. So that's why that's highlighted, so you can see the difference. Because potentially, all of the other plans, including the Blue Edge plan, which is the new option from Blue Cross, all of the others, they have a maximum out of pocket, but you're going to keep paying a copay and everything else until you hit that. So the potential for an out-of-pocket, a higher out-of-pocket is there with all the other plans.
Okay.
And then the other biggest difference is the prescription card. So just so you're aware of that. And did you, I don't know if you had any questions as you looked at this information, but now on the eye exam, notice that United does not cover an eye exam on any of their plans. Aetna, the eye exam is covered with no copay, and then Blue Cross, the eye exam is covered with a $35 copay. So that on the main plans, that's kind of where we are.
Would you say our employees' majority is this $1,000 range? Is that what most of them do, or?
There's a variety, and we have that broken down somewhere. But yeah, I think the majority do the $1,000 deductible. Some, we do have quite a few that choose to go to the $500 deductible and pay that difference in premium.
Yeah.
And I do have, I think I have one that is on the $1,500, or maybe not. Just because paying the $40 a month is a burden to that particular employee.
Mhm.
So they pay a little less and go with a higher deductible.
So you said the $40 was a burden to that employee, the $40 was premium was a burden? Is that what you said?
Yes. And then we have, well, on the second page, I gave you the rates. And the rates that you have on these are their final and best. Now, Aetna did bring us some more rates, some different rates if we bundle, but, so if you did bundle health, dental, and vision, you could potentially have a lower rate on the health, but I did not include that here because I don't know if you're going to bundle that. We can, if that's where you go, then I can show you that and just know that those could go down if you choose them for everything. But we did have a question on the rates because on Aetna, their $1,000 deductible rate was actually lower than the $500 deductible rate for the families, so I think something is off, and we sent we tried to reach Brian by email yesterday and today, and then also by phone. So we're trying to get clarification on that. So I'm not sure if what they gave us was correct.
Okay, so I guess I don't have that sheet with the rates on the
It's
house.
the
Second sheet?
Yeah,
Oh,
it's just
behind
right
it.
here.
Okay, got it.
So really, all I did was just give you the two-tier, and this is, you see the rates for each plan, and then at the right-hand side, you see our current rates that we're at right now. So the second column under each company shows, compared to our current rates, what the increase or decrease is. So on, for instance, United Healthcare Option 2, the proposed rate for single is 66666, and the current is 637.44, which you'll see over clear on the right, and the difference is $29. So it's $29 over our current rate. And employee family is $1542.24, and our current rate is $1474.62. So that's an increase of $67.62 a month. Do you see how I've got that there for you? So then on the next United plan, where it's the Advantage plan, it's a little more restrictive plan. It has basically a little bit of higher out-of-pocket for the individuals. And so that is actually $85 less than our current rate for a single and $247 less for a family. And then Aetna, so you see the difference there. So their package B, on the Aetna plans, I gave you their package B and their package C, and they're both without. I took the $1,000 deductible on all of them just for comparison purposes. You know, that's not the only option you would offer. You would decide what company, what kind of plan, and then you'd look at the options. Usually we offer 3 options, but you could offer, you know, more if you decided to. But the 2 I chose on Aetna, one of them, they're both $1,000, but the maximum out of pocket is different. So there's a $4,001 and a $6,001 for single. And those are the 2 that I picked, was their option B and C that they gave us, or package B and C, because they were both the closest to what we have.
So Tina, I do have a question.
Sure.
On what is here.
Mm-hmm.
You're showing here that the option 2 on United Healthcare for the employee is $666.
Mm-hmm.
And you're comparing that to the current rate of Blue Cross and Blue Shield at $637.44.
Mm-hmm.
However, the proposed increase for that same plan on Blue Cross and Blue Shield is not $637. It's going to be
Right.
$661.
You'll see that in the
I see that in
yeah,
that
that
column
is
there.
that's the proposal.
I see that.
And then if you look beside it, that is the increase from our current rate. I did that the same way on every company, so you can see what we're paying now and the increase that it would be or decrease for every one of these plans. So yes, the Blue Cross Blue Choice, which is the same thing we have now, is currently $637. If you renew, it would be $661.80, which is an increase of $24.30 a month.
Right.
Mhm.
Okay. So, and I guess in my comparisons, I didn't even consider what they're paying now, because the prices that we're comparing on both companies will be going forward. This $637
I
will
thought
be
you-
irrelevant
Well,
going
it's
forward.
yes, because we
Okay.
won't have that rate anymore.
Right.
But I thought you might like to know where you are now and how much of an increase or decrease you're looking at, so that you could
I do.
understand the impact to the budget.
I
So
do.
that's why that's there.
Okay.
And it's separated out so that you can see that that is what we have currently. And all of these, this is what we'll have in the future, should we
Mhm.
choose those plans. And
Mhm.
this is the difference
Mhm.
from where we are today and where we would be for every one of these plans.
Yeah, okay, I
So-
understand that.
Okay?
I was just looking over here, I didn't understand, I didn't know why you would increase, well, you said to show the impact of the
Right,
budget.
to show the
Okay.
impact of where we are today versus where we're going, so that
Okay.
you all understand that.
Okay,
Okay.
so,
And if there's any other comparisons you would like to see, or any other information that you need, I'm happy to provide that. But I didn't just want to try to assume that I knew what you wanted to see on paper, because there are a lot of options, and I didn't want to spend a lot of time, honestly, I didn't have a lot of time even to, beyond the 2 days we put into this, to try to guess. So, anyway, so that's an explanation of what's here.
Okay.
Does anybody have any questions, other questions on that? Okay. Then I do have a chart as well for the dental. It says dental at the top. And so you'll see Delta Dental, Aetna, and then Blue Cross, and that is our current plan. And the plan doesn't change on the renewal, so I didn't make a separate column except for the rates down below. So down on the very lower right-hand corner, you see the current Blue Cross rates. and then you'll see the rates for all the other companies at the bottom. So, and then it just basically goes through. The biggest, of course, difference on this is the maximum, there is an annual maximum per person of $3,000 on both the Delta and the Aetna. There is no maximum on the Blue Cross. There is a deductible on Delta Dental, and then at the bottom in the middle section it breaks it out into services and how everything is covered, but between each company and what coverage levels there are. There is a difference on the implants. Of course, we do have a $3,000 maximum for the year for all services on the first two companies. They do cover implants at 50% up to that maximum. If you didn't have anything else done, you could have an implant covered up to $3,000 at 50%. On Blue Cross, you do have coverage for implants, but they do have a $1,000 limit per tooth. So they cover it at 50% up to $1,000. That's the only limit that they have on actual services, and no orthodontics on any of these plans. We did not. Did you hear back from Brian on that? There is no waiting period for any services on Delta. On Aetna, we're unsure at this point. We have a question in to get clarification on that. And there is a 240-day waiting period on specific stated services for Blue Cross, so bridges, crowns, onlays, dentures, and implants. And Aetna did mention that they have that additional benefit for expecting moms. They get an extra cleaning. So I put that on here. Delta does not have that. Blue Cross, that's irrelevant because you can go as many times as you want to. So an expecting mom could go as many times as she wanted to the dentist and not have it capped. And then I've got the rates the way they were presented down at the bottom for Delta, Aetna, Blue Cross, and then where we are currently on that. Do you have any questions on any of this information?
Well, I do on the Blue Cross and Blue Shield Dental. I see you have the employee proposed, well, that's the current, is at $44.21.
The current is $37.42.
Okay, up here.
And the
it says
proposed.
current. Okay.
Well, that's just because that's our current plan,
Okay.
and then the current rates are over here at the bottom.
So you're having $44.21, and I'm showing on my sheet $46.04.
Okay, well, he brought us a 4% reduction. Is that the one you have here?
This right here is on the, this is on the medical, yes.
Then it's on there.
It's on down here.
Yes.
Okay.
Do you see it?
I do.
Okay.
Okay.
All right. Any other questions?
No, not for me. Do you have anything, Ken? Do you have anything?
Okay.
Randy?
So then I have a sheet for you on those optional voluntary vision plans. Okay. So you have two companies, Surancy and then Aetna Vision Preferred. And the Aetna plan is a full vision plan that they don't have a plan that is just for the materials only. Of course, the Aetna, let's see, the health insurance includes a free eye exam already, just so you know, and Blue Cross includes an eye exam. So they have 3 different plans under Aetna. So I'm in the right-hand column, 2 columns here. I put them all on one sheet here. But there are 3 different plans. There's a $0 copay eye exam, a $10, and a $20 copay eye exam. And then the way that those are broken out, the premiums at the very bottom are listed out as well as far as by each plan. And we don't know if we can mix and match those options because we have that question in, but have not heard back from Aetna on that. And they do not have a plan for materials only for the vision, which is and then we have 3 different plans that were presented from Surancy. One was a materials only plan, there were two of those materials-only plans that were presented. One had a $150 benefit, and the other had a $250 benefit. So if you're looking in the surancy column, the one on the left here, you'll see that they use the Insight Network, and there's 150/250 benefit. Those are the two plans for materials only. In Marion County, probably the plan for materials only is going to be the most useful for the majority of our employees because we do have an eye exam included in our regular coverage. We do know that on the assurancy plan, you cannot mix or match any of the options. So if that's something that you want to offer as a voluntary benefit, the board, you all would need to choose which plan you're going to offer, and that's the only one you can offer. You can't offer, well, you could choose 150 or 250 benefit, or if this person could choose the traditional plan. They can only have one, so that's what we know about that.
So as of today, what we provide with the county is just through Blue Cross Blue Shield is one visit,
Yes, an eye exam, one per year,
one per year.
subject to your doctor visit copay. The majority of our employees, if a lot of people who know they're going to be buying glasses in the year, they will get onto our cafeteria plan, our flex spending account,
Yeah.
and then so they can have an amount of their check withheld every month and put into an account, and then when they go buy their glasses, they turn it in and it's reimbursed. So that's how we have been handling the piece for the eyeglasses or contacts.
And
Not
we'll-
everybody participates in that, but that's the one option that they have
And
to
we
help
will
with
be
that.
continuing the flexible spending
Yes.
plan.
Yes. So, but anyway, does anybody have any questions about the vision plan or any of those offerings?
How would be a good way to, if you decided to go with vision, how would be a good way to set a rate that we would pay? I mean,
No, you would choose what plan, and the rates are here, and
Mhm.
this would be completely voluntary, so the employees would pay the entire premium. The county would not pay for the vision. And this is, it does say in here, it's a voluntary plan. It's it's able to be taxed, it's able to be deducted pre-tax, so that is additional little bit of savings for the employee. For surancy, we have to have at least 25% of our employees participate to be able to offer the plan. So we'd have to offer it, and if at least 25% of our people didn't sign up, then we wouldn't be able to offer it. Aetna does not have any minimum participation requirement, but again, they don't have any plan that's just for like the glasses, the contacts, those things. So.
Do you have any questions? Ted, I thought I.
Well, since that, that vision there's no impact to our budgets. I mean, that, in the end, what's the, I guess we need to know what the impact of budget is gonna be. If we would go with Blue Cross, or if we would go with one of the others.
And I am happy to, I do have it ready for Blue Cross, because I had it ready before and all I had to do is update the rates. But I didn't go and prepare it for every company. I thought I'd wait to see what you all want to see.
Okay. If you can provide
See how
that.
this meeting went, and then I would be happy to provide it for whatever plans you want to look at. I don't know if you want to look at the Blue Cross one that I have ready or not.
I am ready to look at it.
Okay. And we did prepare we have started preliminary, actually worked on rate sheets, but we don't know where the dental's going, we don't know where any of it's going, so we didn't get too far. We just put the rates in that the companies gave us for the options, and that's kind of where we had to stop until we know more from you all. So you had this before, and I don't know which page is on top for you. Okay, so you've got the health insurance breakdown on top.
Yeah.
That just shows the rate breakdown. the second page where it says, let's see. Okay.
And those are last year's premiums. On here.
It shows, okay, are you on the first page?
Yes.
So if you look at option 1, 500 deductible, option 2, 1,000, and option 3, you'll see where it says current and renewal
Mhm.
on each one. So it
I
shows last
see
year
that.
and this year.
Okay.
Okay, so it
See
shows
that.
both.
Mhm.
So you have that.
Mhm.
And then, what's the next page that you have? Because mine are
Impact to
stapled.
employee.
Okay, so the impacts to employee. So if you look at the current rate, the renewal rate, and then at the bottom, it shows the impact per each employee per month. So with our current renewal, if you kept, now again, this will change as far as the impact to the employee depending on what you set the contribution level at, but we did it at the current one so that you could see what that is at the current level. So on option 2, all single employees pay $40 per month, and the family we pay the single rate plus $200 extra towards the family. And so the employee cost on the family is listed here. So your impact for option 2, if you base it the way we're doing things currently, the family plan would be a $24 impact per month increase
To the employee.
to the employee for a family. And on the option, yeah, that's $24 based on the current renewal. So, like for instance, option 2, let's look at that middle column. So you see the current is on the left, so it's $1474.62 plus $84.68 dental, which is a total of $1559.30. The county is paying $834.86 of that premium, and so the employee is paying $724.44 per month. On the new plan, the rate is $1515.61. The dental is $99.26. That's $1614.87. The county would pay the $866.01, and the employee would pay $748.86. So that is a $24 increase per month for those that are on family coverage option 2. Okay.
The family would pay $724.44.
They would pay $748.86. So it's $24 a month more than they pay now. And if you look at, so that's just to show you how that's set up. If you look at the next page that shows the impact to our county budget, say we'll just look in the middle column again, option 2. Current rates are listed, the renewal rates are listed. Right now, the employees are paying $40. And this is prepared, if we keep it at $40, the county will be impacted for health and dental per employee $31 a month. So at the bottom, I have that written, I've got that broken out by contracts and the impact to the budget for the rest of this year. If you take into consideration what the employees are paying, the increased premium renewal that we got for Blue Cross would be a $30,000 impact to our budget if we leave the pay structure the same. $30,000, $119.67 is the amount that I figured. So.
That's just on this one plan where we have other people on the other.
This is for all of it. This is for all the options on Blue Cross. This is only the one company. I have not prepared this for any of the other companies yet because I wasn't sure what all you'd want to see.
What is the amount that we budgeted for health?
$850,000.
$850,000. And I'm showing here that on Blue Cross, the various things right here, based on the participation rate, would be $1,105,000.
That's for everything, including what the employees make.
Correct, exactly. So that.
So that's not the true impact to our budget.
Right,
for the increase.
exactly. I'm just showing that is, so, an increase of $255,000 total overall. Because if you take the $1,105,000 minus the $850,000 that we budgeted, we have a difference of $255,000.
That's actually not,
Total.
you're not looking at apples to apples there, because the budget, the amount we budgeted to spend is only the county's responsibility, the part that we're responsible for, not the employee portion.
Okay, right.
So you're looking
I'm
at
looking
their
at the
figures
total.
is everything.
Right, and
And our
then if I-
budget is only built for the county's part.
Right.
So what I'm showing you on this sheet
Mhm.
is how much more, this is, the 30,000 is the extra amount that the county would have to come up with, not the employees. And it is overall within the employee benefits fund. I should give you a little breakdown of that. But we budgeted 850,000 for health insurance, which is 25,000 more than last year. Usually, we always include at least a 20 to 30% build up on that line item, but when we made this budget for this year, we did not. And so our impact is $30,000. We did start the year with about $28,000 more in that fund than what we had planned on when we budgeted. And so that's quite a bit of the money that would, and then our unemployment, we budgeted higher than what it actually is. So I don't know, I could get the number as far as the impact to the 850,000, but I feel pretty comfortable with this being just a $30,000 impact to our budget, that we would be able to cover that in the employee benefits fund. Now, we have been spending that fund down over the last few years, and so at budget time, you're going to need to be looking at how do we continue
forward
that,
from here.
because our cash carryover in that fund
Gonna
is
be-
not very high, and it's very low, actually. So
And
it's lower than what I would
yeah.
like to see.
And actually, I was figuring that because what you're showing here with your $30,000 impact. Well, this is kind of two different things. Which plan do we want to provide is one thing, and then the dollars are with phase 2 of it. So maybe we should determine which plan first, and then we can get right down to the dollars. I mean,
We do need a decision on two different things, and
Right.
that's true. The most critical is going to be which plan, because we have got to get things moving to be
Right.
able to be ready to enroll people and to
Mhm.
be able to have it in place, so.
Okay. So do you have any suggestions on the plan?
I'd like to make a motion whenever you're ready.
Well, I was going to let the employees speak and let other
Okay.
people have an opportunity to
Yeah.
share their thoughts.
Okay.
Does anybody on the floor have any thoughts on the plan of the insurance? I know we listened to, you guys, all you people, I think everybody that's out there, we listened to the presentations. I know you're all pretty much comfortable with Blue Cross and Blue Shield. I did spend quite a bit of time going through the individual plans, and I even have a letter that was sent to me from an employee, which I thought was a really awesome letter, an email, and I will not reveal any names or anything like that, but in her letter she's explaining to me about the health care. Of course, her concern is that she can't go to the doctor because the deductibles are so high. Although she does recommend keeping Blue Cross and Blue Shield, so it's kind of one of those back and forth letters. I'm not sure she read it after she wrote it, but anyway, she says that it's difficult. It says right here, it may save the county a buck or two if you decide to go whether a cheaper plan. She said, but if you go with a cheaper plan, oftentimes there's more absenteeism because employees are going to wait to see the doctor. By waiting, they may be compromising their health. Until I meet my deductible, I don't always go to the doctor myself with the current plan because of the increased cost. And that's my point exactly, because with Blue Cross and Blue Shield, you have co-pays and deductibles for everything. On United, on preventative, the average healthy family that just gets immunizations, just gets checkups, well-being, there is no deductible or co-payments. That's quite a saving.
On all preventative, Blue Cross is also covered at 100% with no copays on all
It's-
preventative effect as of last year.
And see, I didn't see that in there, and I presented to the people, I actually brought out preventative blood tests that have not been paid. I mean, so, yeah, I know they're saying something, but then it's not providing it. So, but what about with children and so on? They
The
have
only
all the
one-
same things, okay, so preventative, let's just go in with this, let's forget about preventative. Here on your United, just regular physician services, sickness and injury, and this is for the family. There is, okay, covered persons less than age 19, they pay nothing, a deductible, it does not apply. And then all the other covered persons and so on and so forth, it does not apply to the deductible as well.
Okay, so
So-
on, if you look at the main sheet, on the office visit, I did put a child office visit also. And so, you are right, on United, on both of the plans that they presented, both of the types of plans, there is no copay for just a regular office visit for a child under 19 on either one of their plans. They're the only ones that have that.
That have, you say
the no copay
no copay,
for a
yes,
child.
okay.
Everybody else has, the regular office visit copay applies to that. But on the preventative, they should be all the same across the board because that's all mandated by the Affordable Care Act. And so we do have all those preventative services right now covered at no charge with Blue Cross, and they're available in all of these plans.
And I got that, but then also if you go on, you're talking about the children, which does, all three of them do address that, that's true. But then in United, it says all other covered persons. They do pay the copay of $35, but it does not apply deductible. So it says.
That's
a
the way it
deductible
is
does
for-
not apply.
Okay, for what?
This right here is tier 2, this is the
Is this-
$1,000.
Right, but
on
for,
United.
you mean for an office visit?
Yeah,
And that's the way it is for all the plans. You pay, regardless of the company, you're going to pay an office visit copay. If you have other services done, no matter what company it is, those services are going to be billed differently. And then in most cases, depending on what the service is going to depend on, and most all of them, you go to deductible and co-insurance. And if you're talking about out-of-pocket,
no, I'm talking deductible, it says deductible does not apply. I'm saying deductible does not apply.
right, it does
And you
not
know-
apply on any, anytime you go to the doctor, just as a routine office visit, on any of the plans, it's like that. There is no deductible. It's only the copay. You pay a copay when you go to the doctor.
And so even on virtual visits, also urgent care, also specialist visits and
on
stuff. I
urgent
didn't see
care-
that in Blue
On
Cross.
urgent care,
And the interesting thing
Oh,
about,
sorry.
I'm sorry, yeah, the interesting thing about Blue Cross is they just gave us a little, that's it. They really didn't give us a detailed plan to go, I mean, United addresses almost every situation, which was by far nicer to be able to see everything. I'm
Okay.
just pointing out differences as,
we have our
Another
current
that
plan
had
with Blue
that.
Cross, and we could have gotten that for you if I would have known that you wanted that in depth with what they needed, but, or what they, to look at the overall, everything that's in our plan. You should have a copy of it at home with your current plan, but we have that in the office, and we could have gotten it, or we could have gotten it
I
from Blue
just went by
Cross.
what was provided.
Yeah, they all provided a
To-
lot of
provided
information
to us.
because those are all new plans to us. So,
Well, that's what I went by, is what was provided
sure.
by you guys, so.
Is it okay to speak to the specialist copay and urgent care?
Go
Because
ahead.
you mentioned that.
Yeah,
On United, you can see on my sheet, the specialist visit is not free. I mean, it is $35 copay on one plan, and it's $100 on their other plan. And Aetna, the specialist copay is $50 on both of their plans. And then on Blue Cross, the specialist copay is $35 on both of their plans. And then on the urgent care, on United, it's $35 or $50 depending on the plan. And then on Aetna, it is $75 and they have a limit on it. They won't pay it at all if you go to urgent care and it's deemed to be not urgent. They don't pay it at all. But then you pay, if you do go and it is like a proper situation and you go and it's urgent care, it's $75 and then deductible and co-insurance after on their plan, on both of them. And then on urgent care for Blue Cross, it's $35 for regardless of what their plans are. And then all three of the companies do have the virtual visit Teladoc or telephone service.
I see now.
All three of them have that. And those are all subject to the regular copay. Except for the One United, which is their Advantage plan, that was free on there. But your out-of-pocket maximum is $6,500 in network. Now, one other thing to mention on the plans with United and Aetna, and just so you can be aware of it, they do have a separate deductible and co-insurance bucket for in-network and out-of-network. And so if you happen to go out-of-network for something, you're going to start filling up that out-of-network deductible and co-insurance out-of-pocket bucket. It doesn't count towards your actual out-of-pocket for the rest of the stuff that you do. So much of this is going to be paid. Yeah, they are going to pay a percentage of it, but none of that is going to go toward your regular deductible and co-insurance amounts for your in-network. And we spent quite a bit of time really nailing that down with Aetna, particularly to make sure that we understood it.
So Blue Cross does, if you go out of network with Blue Cross, that applies to your existing deductible?
Yes.
All of it?
They do have some fees, because if you go out of network with Blue Cross, you are going to pay a difference in what the contracted amount is and what you were charged, and there's some penalties, but it does not go to a separate co-insurance or a deductible. It goes all towards your maximum deductible and co-insurance on your plan, and then your maximum out of pocket. Is the way I understood it.
Fees, and you said what the original cost was, that's what they pay, is that what you were saying?
Yeah, the way that they structure theirs is if you go out of network, they'll pay whatever the contract amount is, and then whatever the overage is, you're gonna have to pay a percentage of that, or a fee, or a combination.
Do you know what that percentage is? Because I know if you go to the doctor, for an example, and you spend $100, or you bill $100, Blue Cross has a write-off of like $60, $70.
Those are
so
for
that's the difference.
Right.
So you would pay, I wonder what percent of that?
I don't know the exact percent, and it probably varies by service, but Bruce said if you guys have any questions, I think, we can certainly call him if you want to ask those questions, because I don't know the answer to that one.
Anything else?
No, I just wanted to address the things that you specifically mentioned to make sure that it was all clear. The one other thing that I probably should mention is the maximum, the accidental injury. We do have on our current plan an accidental injury benefit where the first $1,000 of an accident is covered at 100%, and then it goes to your deductible and co-insurance. And so that is available on the Blue Choice plan, the current one and the renewal, but not on the Blue Edge or any of these others. It's all deductible co-insurance. So really those are the biggest differences between the plans. So I think that you've kind of brought up most of them.
I wish I would have had the whole Blue Cross plan to look at, because I didn't, that last part that you even brought up, I didn't even see that in anything, so I didn't even know that was an option on Blue Cross.
That's something that we've had in
That was
place, and Bruce usually talks about it. I'm sure he talked about it when he came the first time. But if you want us to get you
No, I
the
don't.
plans, and if you want to look at them over the weekend and then come back on Monday, I'm happy to provide that. If that's something that, or I know they would get it for us.
Yeah, no, that's just fine, there's no sense in wasting that time, so that's fine.
Okay.
So, did you have
I have a
something?
question for the employees, real quick. Go ahead.
Okay, go ahead and ask your
How,
question.
something haven't talked about very much here is drugs. And with the present Blue
Oh,
Cross,
yeah, that's it. I'm sorry.
Blue Cross and Blue Shield, how's your prescriptions going when you're going to the drugstores?
Very good. Very well.
And this is something that's been a continuous, what I've heard from the employees over with Blue Cross is, sometimes they're not happy with the co-pays and things like that, but it's been pretty easy to work with and stuff like that. So I've visited with the drugstores in our county, and they have a preference too of what they would rather work with, and some of them even give me opinions that maybe United Healthcare would cost us more in drugs for the employees that they see that might cost additional employees.
That is, did I not talk about the drug card part? That is okay, let me talk about that. I'm glad you brought that up because that is a huge difference. So that's at the very bottom of the top page of my sheet. But on United, on their first plan, you have a 4-tier. It's basically a 3-tier drug plan. And the deductible is $10, $30. But tier 3 and 4 drugs are all $50 copay. Okay, so that's similar to where we are today, because what we have today is a 15, 30, 45. So that's close to where we are today. But their formulary is a little tighter than what Blue Cross's formulary is my understanding. But when you go to any of these other plans, like the Advantage plan, any of the Aetna plans that we have looked at, and then the Blue Cross Blue Edge plan as well, the drug coverage changes significantly. They go to a closed formulary. They have, particularly the issue is in your tier, what they classify as your tier 3 and 4 drugs. So your tier 1 and 2 drugs, you're going to pay, with the second option on United, you'll pay $5 for a tier 1, $50 for a tier 2. But a tier 3 and tier 4, so tier 3 is $100, and tier 4 is every time you get that prescription, you're going to pay, you can pay up to $250 out of pocket every time until you hit your yearly out of pocket amount. And then so that is a concern. So the way that they work, it's co-insurance. So you would, and the same thing with Aetna, they're similarly structured. So you would pay, instead of paying a prescription copay, so to speak, you would go to the pharmacy if you have one of those drugs, and you would pay a 20% copay, so up until a maximum of $250. So it could be less than $250, but it could be $250, and you would pay that every time that you need that drug until you've reached your out-of-pocket, your maximum out-of-pocket for the year for your whole plan. So that is a major change on the drugs. And I did not, I looked up one medication, just a common asthma medicine that I'm on, and I have not had any time to spend or had any employees really look up any of their medications to see because you can go out and you can look at the formulary and you can look up your med and see what they would charge. And I haven't had a chance to really check into that, but I know that my particular med, it's a new med that the doctor put me on recently, and my copay with Blue Cross is $30, and on these others it's going to be a tier 3 or tier 4 drug, and that's a monthly drug.
And I know with blood pressure, it's all across the board. You can have some blood pressure medicine that is the minimum, and then some of them jump right way up to the higher copays, and that's just in blood pressure medicine.
Yeah,
One
I
kind
mean,
of
so the change in the drug card, is a significant change between the plans also.
And Blue Cross and Blue Shield goes up to $150 in their
Yes,
Blue Edge.
right. And then these others are $250.
So, am I see? Okay, $150. Then it says 20%.
Right. And so the way that our current one is, and the way that the Blue Choice would be, is it would stay as a 15, 30, 45. And now there are some drugs that Blue Cross is not going to, that are non-formulary, and those are your higher deductible ones. But another thing, but it's always going to be 15, 30, 45.
Does that even include, like, of course, the cancer drugs are the highest ones? I mean, high dollar. Would they still, if we had an employee that was taking treatments, would it still fall under the 45?
That, I don't know the answer to
I don't
that.
think so.
If it's a covered drug, it would, but that's a good question we could ask Bruce on how those are
it's just,
handled, because that's a little different
cancer's so
situation.
rampant.
It is, and I would almost venture that it would not be a part of that because of chemotherapies and things like that.
You know, I'm just
And
talking
the
about,
pills.
probably talking about the prescriptions that go along with whatever the
Yeah,
procedure
so
is.
the prescriptions that go along with whatever your
Yeah.
treatment you're having, they are, as long as they're a covered drug by Blue Cross, then that would be the structure of it. And then the only other difference that I was able to get from these plans is that on the Blue Cross, the mail order one, and this is one thing Bruce talked about when he was here, their allowance of how many days is just a little bit higher than on our current plan than what it would be on the Blue Edge or on any of these other plans. And I think it's like 4 days a month more.
We've also been after wellness in this county for quite a while, and that seems to be the goal we've been shooting for. Then come along with Blue Cross and Blue Shield, or to throw in the biometric screen, it's just up to $50 a year.
But that biometric screening is basically nothing. I mean, it's really just blood pressure and your cholesterol. I mean, that's kind of I mean, true, it's important, but it's not the whole picture of prevention, blood testing. I mean, blood testing for prevention is a whole lot more detailed than that.
Yeah.
But, I mean, hey, if they threw it in, they threw it in. That's
Yep.
great. I'm not
Yep.
disputing. It's good, but it's
I think it was
kind of like a little carrot.
Comment up
You
there,
know,
I think.
yeah, I've seen that. So I was just pointing out on that, because I did read all of that. So, anyway, okay, so did you have anything else? Okay, you want to say something?
I did. I want to get back to the prescription thing for a minute. I, for one, or my family has probably 4, I think, prescriptions monthly that we do on the 90-day thing, and I'm not in favor of going to your local Junction City area when they do it here locally.
I don't go to Junction City, I don't know where you come up with that.
You brought up
Oh, I think they were
CVS.
talking about, in the meeting the other day, I think CVS was brought up, that, like for some of these other companies.
Yeah, and they
there
were-
are special pharmacies that you go through for some of those things.
Right, and they
To
were
get
also
that
saying
90 days
that on
supply.
CVS, there's like Targets, and I was pointing out Salon.
Right, and I think the comment,
Wichita, I mean, all over.
I think the
Yes.
comment is that people would like to prefer to try to do it locally rather than going to one of those other communities if possible. Is that correct?
That's your point, okay, yeah, okay, got that. I was just pointing out that somebody made some sort of deal like CVS was on the moon or something. Well, it's not necessarily that far away, was my only point. Not necessarily that that's where I would prefer you to go,
Right.
but, ma'am, you have something you'd like to say?
Yeah, I work over at the EMS office, and this is not a financial at all, but I have to call United Healthcare a lot, and the gal that came is not who you're gonna get on the phone. That just, as a provider, usually we can get right through a lot quicker. I can't get anybody that speaks English even clear enough to understand them. And it's so frustrating, so I can't imagine if you're just the employee calling in, you cannot get anybody that speaks clear English. I mean, it's horrible.
That is horrible.
It
and
is
that's-
horrible, and so what they send to represent is not who we're gonna get to deal with. And like I said, it's not a financial deal, but it's gonna be the everyday frustrations when you're trying to call your insurance company.
And I fully understand that, as I pointed out with my blood results. And I too didn't speak to Bruce when I made the calls.
No, that's
So-
United. She
so-
said it was United.
I know,
not
but I
Blue
was
Cross.
using the comparison, that I understand what she's saying, it's not limited to United. The same thing happens in Blue Cross.
Well,
So-
when I call Blue Cross, I get same service as when I call when I'm an employee. I clear speaking English, and just as good a service as a provider as when I call for my own insurance.
Okay,
So-
Oh,
What you're saying is you're probably with United talking to like a national
Yes.
center instead
It's
of
probably
a,
not
instead of a
anybody in the
state center.
United States. They can't speak English, but their name's Bob.
Yeah.
But,
that's interesting. I really didn't bring this up as a point, but I did have a note from Bruce that basically, he did say that their customer service center is in Kansas and it's staffed by Kansans, and I didn't think that was a thing, so I didn't bring it up.
Well, I thought Edna also said the same thing, pretty much everything was in Kansas, but anyway, go ahead,
I'd
Phyllis.
like to add that as a former customer, a covered person with United,
my experience as someone who was their insured was as bad as yours.
Thank you.
Yeah, I would spend sometimes more than 45 minutes on the phone, on hold, getting transferred around, and still wouldn't get my
And
question
sometimes then the
answered.
call drops when they're trying to get you somewhere else.
That's what would happen in my office if I had to transfer, because I'm really bad with the phone.
So their service for their own customers is as bad. Now, I've never called them from your position as
Providers.
the provider, but I can tell you that I would hit the end of my rope and start screaming at people.
Right. And I deal with a lot of insurance companies, and they're the worst to try to call about a question, why they denied a claim, or just, I mean, out of all the ones we deal with, they're the worst.
Customer service is a big deal, it really is, you know.
Well, that's if you can
And, you know,
even
we're
get
just
a
sitting here
live human.
looking at figures, but, you know, it is something that has to be taken into account, that customer service means a lot.
Because with United, it's hard to get to a person. I mean, their whole rigmarole of push this number, you're lucky if you ever get to somebody.
Does anybody else have anything they'd like to add?
I would just say on the wellness piece, if that's okay. 'Cause I'm
No.
not- Okay. I thought that it was neat that some of the plans that, when they came and presented, the wellness piece that they have, you know, it seems like the wellness part and the wellness programs they offer are ahead of what Blue Cross is offering in wellness, just as a comment, but.
And I see, Lisa, you had something.
Yeah, I was just going to say I had a chance, obviously, to visit with my staff over the period of this time. And I think first and foremost, I think you need to know that they are very appreciative of what the county does offer. I do think they have concerns switching from Blue Cross Blue Shield. I think it's because it's a comfort zone. I mean, I'll just be honest. I know that there's concern of prices and everything else, but I know you guys have a tough choice to make, but I just think you gotta know it is very appreciated what you guys do.
Well, that's refreshing to hear. Thank you. Anybody else? Okay, so, that's their comments on the floor. So Randy, I guess, you're gonna go ahead and ready to make a motion, am I correct, or did you have any other comments?
You know, unless the commission has anything to change anything, I think for me, we do have to decide what we're gonna do with our Tina's figures here of she's figured that, what the impact to us is here on that. But I just haven't seen anything that I can change my vote to go away from the present plan that we have. And, you know, last year we made the decision that they did shoot us out of the sky, and we decided to go somewhere else till they come back and got reasonable. And I think all these visits that we've had from other companies has made them realize that they want our business, they're gonna have to continue to stay with us and work with us and things like that. So I guess if nobody else has any final comments, I would make that motion to continue with Blue Cross and Blue Shield, but I'd be interested to hear anybody else's comments first.
Which plan?
The one we have, the BCBS, the Blue Choice, that's the one we're on, not the Blue Edge. The Blue Edge is the other one that he did offer if we wanted to change. So that would be my motion.
Now, this is to choose the plan.
Yeah.
That's
Yes,
where
just
we're at
to
right
choose the
now.
plan,
Just
yes.
to choose the plan,
Choose the
okay.
plan, yes.
All right, so you made a motion to go ahead and stay with Blue Cross and Blue Shield, Blue Edge?
No,
Yes.
Blue Choice.
Blue
Choice.
Choice.
I
Blue
thought you
Choice.
said Blue Edge.
The Blue Edge is the one that if we wanted to change something.
Okay, Blue Choice, I'm sorry.
Yes, Blue
All right,
Choice.
so do I have a second?
Second.
Second, okay. Personally, you know, I think the plans are an apple here, I mean, a give and take here, it's a back and forth, so I'm not gonna dispute which plan the employees are happy with as phase one. We'll deal with the cost in the next motion, so I'm gonna go ahead and say, all in favor, say aye.
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 Aye. Blue Cross will be the company that we stay with. So, next thing we're gonna discuss is going to be the cost. Are you ready for that, Tina?
Sure.
Okay. So I'm gonna just jump right into it, and I have been pushing these figures around, and, I took the whole plan, and I took what we budgeted, so on and so forth. Here's my thoughts, and here's where I'm going. I appreciate everybody likes Blue Cross and Blue Shield, and I think the employees have enjoyed $40 a year, a month premium, for a long time. I am not in favor of raising the budget at all, so I think the employees need to bite the bullet and pay the 100% difference. Now, right now, I think you're proposing, correct me if I'm wrong, Tina, so the existing 40, somewhere in here you said it would be an impact of $20-some more? Am I right? So you're talking about maybe $60. I think the employee should probably pay at least 30% of the premium, whatever that calculates out to be. In today's world, the taxpayers, I just cannot even face the taxpayers and ask them to pay these type of increases. This is a large overall increase to the taxpayer. And so I really think that by having, insurance is a benefit, it's a privilege. And we do try to provide the best that we can, but we also have to remain what we can afford. The county has a lot of stuff going on with the transfer station and different things that we have to accommodate. I think the employee has to pay a fair and reasonable percentage of these premiums. If you did not work for the county, I guarantee you won't find a premium out there for $40 or $60 a month. Just will not. And if
My
you
husband
can,
works,
if
excuse
you
me,
can,
my
that would
husband
be
works for a private company within the
Excuse
county.
me. Excuse
And
me.
his insurance is still paid 100%, just so it is still out there.
Excuse me, I said if you went out on the open market, you wouldn't find it. So if I went out on the open market,
There are
I
counties
would
that
not
do
find
that.
Right
it.
now, that's not public comment time, so let's wait.
So, I'm just saying, I think the employee, and I would almost bet private companies are not funded by taxpayers for their benefits. The company is paying their benefits out of profits, not taxpayers. So, I'm saying the employees need to pay a better portion of the premium. I think that's the right thing to do, and that's where I stand. So, Kent, we have to protect both people. We have to make sure they have fair coverage. Why, I'm not saying we have to, I'm saying we want to make sure that they have fair coverage at a reasonable price. But on the same token, we're going to answer to our taxpayers. And we can't keep just giving because we want. So I'm saying we need to compromise here on these premiums. So Ken, I'm going to let you speak first. Where do you stand as far as protecting?
Well, I understand your thoughts. I think this is a benefit that we provide our employees that actually brings us and retains employees. It's our best benefit, it's our biggest benefit. And I also understand the impact it is to the taxpayers. And as commission, we have to look at both sides of it and try to do what's most fair and most equitable. And I understand that I don't want to just totally annihilate the budget. We do need a little bit of comfort zone in some of those funds. Employee fund, we're probably going to draw down to nothing with the
Sorry.
So, I'm open to listening to all the commissioners, and if there's if I need to compromise somewhat, I'm open to listening to that.
Randy, it's your turn. What's your thought on the cost?
Okay, the single goes up for that employee $24 a month, if we stay with where we got the Blue Cross Blue Shield, okay?
Right.
So that's one decision to me, whether I'm overcharging my singles and, for $24 a month increase, if they was, on Diane's side, if they was have to pay it, and you look at it on our side, if we was have to pay it, so. And then the $40.99 for the family plan, and family's hit pretty hard already. I mean, they are, they, for young, and, you know, I don't wanna run anybody off, whether it's older or young person, but you'd like people to stay for numbers of years because you get good employees to stay, and they have to meet the grade if they're gonna stay on board, or the supervisor should be doing something with them if they're not meeting the grade. It's an interesting question here. 4.4% is about what it was total.
Yes, and if you all have some ideas of what you think is reasonable or what you want to look at, I can prepare, because, you know, this, of course, we're just looking at one option. You don't
Right.
have any of the other, like the option 1 or 2, you only have option 2, you're not seeing option 1, 2, and 3. But I can prepare information, I can give you information, a summary sheet or something from the budget that shows where we are with all our line items in that fund. And if you give me what you want to see, like if you say, well, we want the employee to pay $50, I could show you how that impacts. Or, you know.
So my question to you is, with an employee premium going forward, not what we did in the past, but with an employee-only premium of $682, or $661, or $645, that's the 3 different choices that we have here. The total premium being $660. What would the harm be of that employee paying at least $150 towards that premium?
That would be
I'm
a big
saying-
impact to their paychecks.
That would have an impact to their paycheck. However, on the same token, we have taxpayers out there that have to pick up this bite. That's not fair. You know, we are responsible to the taxpayers, and they have to pay this difference. And they're struggling to pay their own. What do you pay a month, Yvonne?
I don't know, it's on Larry's now, but, when we were on Obamacare,
Mm-hmm.
it was $1,500 a month for Larry and I.
Mm-hmm.
And it didn't pay all that great either.
Mm-hmm.
I can tell you this, when I worked at the hospital and I was the one that was insured, I paid over $140 every month, regardless. They didn't ever pay the full amount.
And I know people on Social Security that pay supplementals, they're paying $180, $190 just for the supplement, plus the Medicare. And these are the people that are going to pay this increase. I just don't think that it is fair that we asked our taxpayers to pay this. I just don't think it's right. Let me give you one opportunity. Go ahead.
We are taxpayers as well.
You are taxpayers. You certainly are. But let me ask you this question. As a taxpayer, your taxes contribute to the roads and the hospitals and the things we're building. How much of your tax dollars pays his in premium? How much of your tax dollars contribute to his premium? Not a dime. That's how much. 0. On the flip side, how much does he have to come up with to pay your extra benefit?
And when we get to that point, we'll be in that same boat.
Well,
That's
and-
not the question today. The question
I
today
was
is these people out here, we have families who are trying to make it, that are paying $1,400, $1,500 a month for their families. And for you to not be willing to contribute a fair share to your premium, I think is terrible.
You don't think $800 is a fair share?
I'm talking about the single person right now. And I didn't get to the family yet, because I will. Because under what I'm proposing, the family would only pay about $500, which would give them a break. I think the families pay way too much. I think it's kind of discriminatory for us to have the families pay 54% of the premium. I'm sorry, the county pays 54% of the premium to the family, pays 94% of the premium to the employee. That's kind of unbalanced. There needs to be more of a fair balance. So if the employee, instead of $40 or $50 a month, which is nothing, steps up and pays a little bit more too, because their premium is almost $700. The taxpayers are paying the rest. Older people young families out there working with children are paying $1,400, $1,500 a month, and you're not contributing at all to that. I don't know how you can do that. I just don't. I think you need to pay. I think you need to be a little more responsible for your health care and be willing to. I mean, to get you the plan that you like. If this is what you like, I'm willing to work with you. You can have the plan that you like. But then to say he has to pay more because this is what I want, that's outrageous.
Were you gonna suggest that on United Healthcare though?
Absolutely, across the, I don't care if it's, I'm not, no. Because, like I said, and even as she compared so correctly on her sheets, the premiums are close. Give one on this one, take it away on that one, it's very close. I'm looking at the county right now, I'm looking at the budget. I'm looking at what we're doing to our citizens. So if you pay $150, let's just say that for an example, and he pays $180 or whatever it is he pays, I never ask you, but I know it's close because I know what people pay for supplemental insurances. I don't think that our government should live a better lifestyle than the people who supply their paychecks. I just don't. He's working to provide your paychecks and your benefits. He's giving that to you. And I'm using him. He's symbolic of the elderly people, is what I'm saying. It's not fair. So, Tina, I know you want to make a comment.
I was just going to mention that the county provides services to everyone, and that's why we're here, is to provide services.
Yes.
And the cost to provide services includes your employee costs. So it's not, the people are not paying to give the employees a better standard of living. They're paying for services, and that's part of the cost of the service. So I just feel like that needs to be out there. It's not.
And that's a valid point. However, I will also say when we throw us all in the same bucket of taxpayers, like I pointed out to Melissa, I believe it is, I'm sorry, to Melissa, it's true. We all pay for those services. She pays for the roads, she pays for the services, he does. We all pay for those services that are provided. Now, as an employee, when you get into benefits and bonuses, that's where the people out here in this bucket pay for that. They pick up the brunt of that. And all I'm asking is a share. Pay your fair share is what I'm saying. And I just think $150 for the single person is more than could be asked for. I think it's, I'm sorry, I said that wrong. I think $150 is still exceedingly generous to the county employees, and I think it would be right for them to pay that. And then you asked about the family. I think on the same token, if the family paid $500 a month, that's going to give the family a break because they have been paying $700 and even more. And that would take, if you take and have the, based on the way it was before, we have about 18, 20 families. And the rest are employees if I'm close, based on the information that you provide to Blue Cross. Am I close?
13 families, right?
Yeah,
No,
we
that's
got
talking
more.
three,
Yeah.
that's talking three.
I'm thinking it's 18, based on what I see.
Okay,
but what-
But
I'm
either
just
way,
waiting
it
for
doesn't
your
matter,
reporting.
it doesn't matter. So if we have 88 employees pay $150 on towards their premium, and if we have 18 families pay $500, that's going to give the families a bit of a break because they have really struggled over the years paying $700 out of their paycheck. That's going to take the brunt of, that's going to take the whole increase. So we will not impact the budget. They just pay their fair share, still get a good price on their insurance, get the plan that they want. How much more can we give?
Well, the only thing that I have on that is that if nobody changes, then it works. If you have 30 more families jump on because now maybe they can afford it when they couldn't before, then your budget is impacted the other way. Because you're going to, do you see what I mean? There's
I do,
no
because
way to
I
really
even took
plan
it up.
that for
I
budgeting
even took it up to
purposes.
allow for that. So even if we want to just go, okay, so you can keep it, we got to do some more for the families. We gotta be better on the families. I think the families are really being taken across the coals in their premiums, I really do. I feel bad for the families to have to pay $700 and some a month for their premiums. I think we need to reduce those. So, okay, so, and I'm just using basic figures here that we have. This is all I have, is what was provided to us. But I think we could sit down, once you get all the more facts and figures and things like that. I just think, or even if you just go with 150 for each single, or not single, but employee, or $170 for each employee, would help pick that up. And you could reduce the family, even if you didn't want to take just $500 for the families, you could even take 150 off of their premium, whatever it is, and then if you had more families come up, it wouldn't impact, it would be a balance there a little bit better. Are you following my figures? Without having the exact figure of how many families there are, it's difficult, like you said. to
Right, and I
pinpoint.
can try to put something together so you can see what that looks like.
So
That's
you-
not a problem to do.
And I
I'm
could
just-
do that real quick too. I just did it with 18 families.
Well, I'm not,
based on
I
what we
would
have.
provide more in-depth and I would not provide it like right this second. I would have it for Monday. I wouldn't want to try to rush through
When
that,
do you have
so.
to have this finalized?
Well, we know what plan we're going with, so that is the part that we need immediately, and the rest of it, we're gonna need to know very soon, but it doesn't necessarily have to be today. So that's what I'm saying, whatever any of you think you wanna look at as far as impact to employees, impact to budget, based on whatever
How about if I put
conversation
it to
you
you like
have.
this? With the impact to the budget, keep the budget flat to where we do not raise the budget at all. You could tally it out as to how much they have to pay them to cover that extra cost.
Well,
I
as of
did-
right now, the budget would cover it. The problem is, no matter what we do at this point for next year, going into the budget year, the employee benefits fund has been spent down over time, and so I can't tell you that you may not have to raise it going forward to, but you can't raise, it's under the tax lid, so you cannot raise the overall budget. And so basically what you would have to do just to keep us operating in that fund, and you would have to do it regardless of what insurance plan we go with, is you're probably gonna have to reallocate some monies from another area to that for this next budget cycle.
So if we leave the families out of it at the moment, and just raise the premium to $150 for the employee, that in and of itself would substantially take that impact off, or very, very close.
Well, this $30,000 impact, is that what you mean, just the 30,000?
I'm talking about the difference from, I'm talking about the increase, yes.
Right.
Mm-hmm.
I can figure out what actual cost that would be for an employee to cover that before Monday and have it for you. But it's gonna be not very much. It'd be a small amount.
To cover the whole thing. Well, then why would we not do that?
Well, I can give you that. You're asking me for the number. I will have that for you on Monday.
So then that way, going forward into the following year, the amount that we can budget would be another $850,000 because we would not have an impact. We would not have to raise it.
Well, you still will have an impact on your budget because the fund doesn't have 850,000. I mean, you're gonna have to basically levy the whole amount, because over the last several years, you've been spending down in that fund, so yes, it's a flat, it could potentially be a flat impact, as long as you don't keep adding people, which we have been adding people.
But we're not going to be adding massive amounts. I mean, a couple of hires here or there. So it would fluctuate, and
Right.
people will go from family to single to what, you're going to have fluctuation.
Right, but one or two people, adding the coverage for one or two people is a large number.
And that would happen if we didn't, if we did not
Right,
have the
so-
employees pick up more money, then that's going to impact the budget even greater, is what you're saying.
What I'm saying is, what you're asking me as far as keeping it at 850,000, I don't know that that's gonna be prudent, because if we add any people or we do anything else,
Well, I'm
And,
not-
and I just don't know that the budget will be flat, is what I'm saying. I can tell you that the budget for this 2018 can handle this increase in that fund, whether you have employees contribute more or not. But for next year, regardless of what plan you pick, I think you're gonna have to be looking at the employee benefits fund and what you're putting in it, because we've been expanding our government, and we haven't been expanding the fund. Like this year, we didn't increase. And so, every year in the past, we've increased, but we keep spending it down. And so, your cash carryover is gonna end up being the issue. But again, if you wanna keep the overall county budget flat, that's still possible, but you're just gonna have to look at reallocating some things, so.
So if the employees, if we just go ahead and say the employees will pay $150 a month for their health care.
Well, I can definitely give you the numbers of what that does. I can
Okay.
provide the numbers.
So if we did that, though, we would certainly not, you're talking about impact. If we did that, the impact would not be that we're gonna have to come up with more money. It would do anything that would lower it, because now you have more money coming back into it. And I understand
You
you're
would
saying
increase,
fluctuating.
you would potentially, depending on what you do with the families, you could potentially increase your cash flow if you have employees left. I know that, I know what you're saying about the 150. And to a lot of people, that is a lot of money. That's a lot of money in my family budget. And to do that all in 1 year is a big jump. And so, I'm not saying that, and I'm just putting this out there for you, because I know how it impacts a family. And I know how,
that, too.
there are a lot of people in this county that make a lot less than I do.
And see,
And that is a huge impact to a $12, $13 an hour employee. That's huge. It's huge.
that's exactly right, and that's part of my point too. As much as it's gonna impact the employee who is actually receiving the benefit, look what it's gonna impact people like this. I mean, the same thing, you can impact, there's an impact both ways.
I think we've all heard that. Yeah, we all
Yeah,
understand your
so,
points.
okay, so, that's my point, and that's what I wanna do. I'd like to make sure that, I want to get the employees to step up and pay a portion, yes.
Okay, I have that as a note, so I will bring the figures, what that looks like, if that's what you all want to see. I can do
Okay.
that.
Did you have something you wanted
We
to say?
have more questions.
Well, I didn't open the floor yet to that. I thought maybe you had something you wanted to say.
No, I was just bringing up the fact that employees had some questions.
Did you have anything that you wanted to say?
Yeah, I will tell you that since I've been here, that when I come, that I question and I voted to raise the family pay from the county side, I think twice since I've been here, I believe, if I remember right. And that's always been a concern of mine. But we don't slam the skillet at them right off the get-go. Somehow, they have to know somewhere we may be working towards a more equal basis. But I'm not going to throw the skillet at them. And right now, I think that the $40 a month for a single plan is too cheap. I think we probably need to do something in that area. I don't know where my goal is, you know, it's high. I don't think it's 150. I don't know where it's at right now. If I guess the last few years we've seen the kind of increases, at least, what was the total increase? Was it 8%?
31% last
No,
year.
how much?
31% was our increase last year on Blue Cross and Blue Shield. This year was 9, and then talking down to 4.
I
So,
didn't
but
think
last year was 31% increase.
Yeah, I don't remember it being quite that high when they come back.
The
second
first
time.
renewal, the second.
Yeah, the first one.
When we
The
went
second
first.
one, when they come back,
The
wasn't
one we
that high.
actually paid was somewhat less.
Yes, yes, yeah. But what I'm saying is if our insurance continues to go up, yes, we are responsible to our taxpayers. But first of all, I think the biggest thing that Kent talked about is the employees and staying with us. I know some of those 36 employees will probably drop off and go somewhere else if that single insurance gets probably too high, because that's probably the reason why they're with us. The 41, I don't know how their feelings are, whether that's just they feel they can afford that you know, whether that cuts the cost a little bit more to fit the family, or, you know, employee or whatever. But I guess my goal right now would be either $20 or $25, raise the singles, and maybe kick back more, maybe raise the family pay up to $50 more a month or something. I don't, some figure in there, I'd like to see exactly how that works out too.
You
You
said
know,
the family paid, is that what you said?
the county pays another $50 a month more, or 75, I don't know. Somewhere, I agree with, somewhere the percentage should be a little closer than what it is. But that's something we probably should have done, should have been trying to at least $100 or $50 every year and continue to get it to more evenly. But I'm not in favor of throwing the skillet at them right off the get-go. And so that's my opinion.
Okay. So, you're gonna get some figures though, because I wanna see, I have my figures as to what I came up with. But
Yep, I'll provide some numbers for.
Provide some numbers.
Could you also provide the numbers based on what Randy's brought up too?
Yes,
So we'll have,
that's what I will. I was going to put something together showing if we raise it $20 or $25 for the single, what that looks like. And then also if we paid 50 more in on the family. And then, so the one you want, Diane, me to figure is with singles paying $150 a month. And
see, basically, you're gonna be in the same boat that I am, because you're gonna, in what you're doing, you don't know if by giving the families a little bit of break, if you're gonna have more families come aboard.
right.
So.
right, that's what I said.
That's what
I
you
mean,
said to me
that's the
down
way
here.
you don't know what, well, the last thing you said was, to hold off on the family, but, so do you want me to figure the numbers with our current structure with the families paying 500?
I'm thinking, all these numbers right here now, all these different options are kind of, but the way I had it figured out, I'm gonna stick this way I had it figured out, so I can present it to you better. I'm gonna say at this point in time, the employee, $150, and then take $150 off of
Okay.
the price of the families. Because they're up to 700 and, what did you say it was?
730 or something?
Yeah. So even if you took, they're still gonna be paying 600 at that, give or take, for the family. Yeah, something like that, because I'm gonna give, I think they're just paying way, it's not fair, the balance, the way it is. So, I'd like to see what that is, those
Okay.
numbers. And then where that also impacts the total budget.
I can do that. The one factor you're not gonna know is how many more will jump on. Which
Exactly.
maybe it won't be that many because it's still.
It's still big, that's right, it's still, to go from 150 up to 600, I doubt that. But I think that'll give the families a little bit of a break, and the taxpayers as well, because it'll take care of that, pretty close, it'll take care of that increase. And then they'll be happy they have the plan they want, without breaking the budget, I'm hoping. Do you have anything else, Randy?
No.
Do you have anything, Carl? You didn't say anything? Okay.
I'd like to say that, is there not any way they can come up with a plan for an employee and spouse instead of only employee and family?
We have looked at those 4-tier rates, and the problem with it is, and the reason we've never gone to it, we've looked at it just about every single year. The problem with it is, on the 4-tier rates, by the time, yes, you can do that, and it is a little less expensive for the spouse and
Right.
or the children, but it adds like $400 or $500 on top of the family premium, in addition
crazy.
to what, for a true traditional family. And that's why the county has never gone that way, because it is just such a huge impact. And we do have several families that are
Okay.
full families on the
Well, and
plan.
I've heard like from, some of the sheriff's officers, they don't make that much money
Right.
either.
Mhm.
And that's a real hardship for them.
It is for
A lot of
anyone
them.
with a family, and a lot of times, a lot of times because of the cost that the spouse or the single child or something there, those people are going for coverage elsewhere.
Right.
But
wouldn't
they
get it
can't
from
always,
Obamacare,
they
gee,
can't
believe me.
always, and so. But overall, yes, there are plans that could be slightly cheaper for those situations, but it is a huge impact
Long runs.
in addition to on the families.
Okay.
So do we also still have, I said to you, I think last year, Aflac as a supplement, which is a very inexpensive supplement. Did you say we have Humana? The equivalent to Aflac, we offer Humana or something?
Yes, we have lots of voluntary benefits with different types of plans, and so we have accident plans, we have cancer plans, critical illness, all of those things, and those are all supplemental plans, and the employees can pay for those.
Exactly, and I think they're relatively reasonably priced, they're not real expensive. So, on the families, they would be able to, if they need it more. Well, they have better coverage this way too. So, yeah, I'd like to do better for the families, and, so yeah, you got what I have. Anybody else have anything else?
Anything different you want to see?
You don't have anything different? Okay.
I have a comment.
Sure.
First of all, I think I agree with all the commissioners, staying to the budget. I'm kind of leaning a little on Randy's side about maybe not the frying pan and quite so much with 150, but I also think you aren't going to lose any employees because working for the government is an excellent career. I'm sure you can laugh all you want, but the private sector is not as pretty as people think it is. The benefits that you get in county, city, state, federal, we don't have 401k, we don't have pension plans, we don't have any of those things. And anybody that says they're going to leave because they get $40, put more on their insurance, is just plain silly. I mean, they're not going to leave. I guarantee it. So anyway, no sour grapes here. I should have stayed with I had a state job that was great. I should have never left, and I could have been retired by now. Anyway, that's all I have to say. You aren't going to lose anybody over 40 bucks, 50 bucks.
Go ahead, Phyllis.
I'd like to add, and I don't know if Tina's actually going to, when she provides the breakout, provide this piece too. But your cost of your health insurance is a pre-tax deduction. It actually is, part of it is offset to the fact that you do not pay income tax on that amount. And that would be a case-by-case, person-by-person situation, which would be, I think, a lot of time to consume for you to break that out for that. But $40 more is not, paid for in the insurance, is not $40 less on your check. So that's just something to kind of keep in mind. It is a pre-tax deduction, and it reduces your income tax load.
And even having said that, even if you went up to $50 or $60 or $70 more or something, it's just not a whole lot of big difference. It's going to be an impact, but it's just not going to break any bank, I don't think. For everybody, I'm covering all sides. I'm just looking at everybody. Good coverage. Let the people out here eat a meal or two every now and again too. That's all I'm saying. And did you want to add something else?
Yeah, and back to your statement, there's still a few counties that pays both family and health. I mean, both complete. I don't know what their income base is in their counties, but we have had road and bridge employees, a couple in the last 5 years that I know of, has went to another county because of insurance. And so it's a concern that we have to be aware of. if there's a neighboring county paying.
Except those people aren't probably leaving, so.
Yeah, most people won't, but
Yeah.
this was a young person, and they made a move because they could.
Right.
And I don't know whether they was even married or not, but the two that I'm thinking of, I don't know. But they did leave, and the comment to the supervisor was because of insurance was completely paid by another county, so.
And I would almost think that would be true in your bigger counties, you know, like your.
Not the one that I
think
know
that-
of, but it's.
Just depends on your tax base.
Yes, your tax base tells you what you can do, and that's, so, we've lost employees because of insurance, whether it be down here or just, the last one was, well, I'm getting my insurance.
And you know, people do make career choices for a variety of reasons. And to some people, insurance is, but not everybody. There's other reasons that go into that too. So, anything else? Anything else? I know that. Now I'm asking the commissioner first. You done?
I'm done.
Okay. I know you're done, Randy. Okay, so I'll open up for last on the public comment. Go ahead.
I have a couple. Mitchell County is one that still pays 100% employees, single, family, all of those, and it's comparable in size. Just wanted to say that. The second thing, I have a question. In coming to all these insurance meetings recently that I have, it seems to me that you, Diane, have the county insurance plan. That's what it sounds like. I, as a taxpayer and everybody else, would like to know, one, what you pay for your portion, and two, what your is going to increase to with the new plan.
Exactly the same as yours. Exactly the same as yours.
You pay the same as the rest of us?
Yes, I do.
Family?
I don't have a family plan. I don't have children on my plan, so I don't have a family plan, no. And my husband is on Medicare. So I don't have a family. But if I had a family and I chose to pay county insurance, I would pay the same as anybody. And I'm perfectly happy to pay $150 a month. Knowing what is out there on the open market, that is a steal at $150 a month. And I know if you work at the county for a long time, you don't see that, but I paid those premiums. And my husband is paying for his supplement $192 a month, just for his supplement. So, and that doesn't just go to old people, you know. There was a couple families that were going to come here that are paying $14 and $15, and they're paying the whole thing, and they're getting no help. They're struggling. They're struggling. And to raise their taxes and all the things that we see going on in the county, I see our taxes going out of the roof this next year because of all the things we have to do. I mean, a little increase here, and a little increase there, and a little increase there. Overall, that's going to affect the budget a lot going forward. So did I answer your question?
You did.
Yes.
I was just wondering how, you being an employee too, what your portion was, so.
Exactly the same as yours, if you're an employee or any other employee. Exactly the same. Any other public comments? Go ahead.
On mine, I guess my point is I was hired with my insurance being paid. And so it's kind of a bait and switch a little bit to do that, but I understand times are changing, so I'm willing to pay some. I think all taxpayers' insurance has gone up, everybody. So I think the county has to accept that it's going to go up some and absorb some of it too. And yes, I need to absorb some. If I'm not happy and you're not happy, we probably have a good middle ground, yeah. And, but if it's a 4.2 or 4.4 increase, then you take 2.2, I take 2.2, whatever it is. But also, and that's probably not going to make family happy, I also was hired as an individual to work here, not my family. So I don't know why somebody wants to add their family. That should be I have to absorb that. I couldn't add my daughter on to mine. I called Blue Cross and Blue Shield and got her own policy for $140 when I first signed her on, because I couldn't afford family, but I found a way around it, just put her on her own.
And that was, how much?
140. It's up to 180 about 10, 11 years later now.
See, so it just goes up, and eventually you just have to say, stop, enough.
But you can't, they're
Enough.
never going to. In health insurance is always, everything goes up.
And it does.
everything, the
It
cost of
does.
everything.
And that's why I say I'm perfectly
But
happy
the
to
pay's
pay.
not always going up to absorb that.
But I want to also mention to you, now you know we're gonna look at restructuring the pay plan. So, hopefully, we haven't got to that point yet, but I would have liked to have it done by now, but we haven't got to it yet, but we're gonna be getting to it very soon. Hopefully, my goal on the pay is to make sure that every employee is receiving a fair pay, competitive to the surrounding counties, but more so a fair pay for the job description that you're doing. What that's gonna look like right now, I don't know, but it could be substantial, it could not be. And I'm saying if we pay our employees fair, and if we're fair in the way we spend our tax dollars and the benefits that we give, it's a win-win for everybody. I'm just asking for fair and equality. I'm not trying to rip anybody off, not you ladies or employees, and not the taxpayers. We've got to have a balance. Everybody has to be responsible. And it's painful when it comes to money, and I understand it. I struggled. I went years without health care because of the price. I mean, but nobody wants to hear the old people's story, but it's rough. It's hard. So,
When we need it the most, we have to pay the most when we need it the most. We
I
don't need it
know.
when we're young
It's not
sometimes.
right.
Some people, but a lot of young people do.
that's right.
So,
So, I agree. Tina, do you have anything else? Ashley? Okay, I'm going to make a motion to adjourn.
Second.
Second by Randy, all in favor say aye.
Aye.